Hi guys. From one of our media platforms, one of the questions that we had today, I believe this one was from YouTube, was about a French Bulldog. This particular individual said he had an 8-year-old French Bulldog and had an ear infection, went to the vet, got treated. Seemed like over there overall everything went well, but had a concern on the follow-up that the patient couldn't hear as well, and kind of worked through that process a little bit. So I'll do the best I can. I don't have all the details, don't have all the information. There's a lot of different factors that I just am flat out unaware of, but I'll kind of extrapolate from the normal average thing that I see and then kind of take it from there and see if that'll help your fur baby. Different geographical regions of the country will be very different. So all I can do is extrapolate from my El Paso area. And even this year has been dramatically different than most because our dust storms have been way worse than normal and our wind has been way worse than normal. So much so that we actually set new El Paso Dust Bowl records. Yay! That did not help these problems. So ultimately, that ties in with a lot of ear infections. How? A lot of underlying allergies predispose to secondary ear infections. And this time of year, and given just the weather that we had this year, I did see a dramatic uptick earlier and longer durations with patients having these problems than what I normally see. Well, that's because of the environment that we were in and the culture, and you can't control the weather and there's only so much you can do. Can we minimize things? Yes. Bring them inside, have better filters? Yes. But we're still breathing outside air in some fashion that's been filtered. Maybe, maybe not, or you got to walk outside to go to the grocery store, go to the bathroom, whatever it may be. You get my point. So, yes, environment does play a role, and there's so many other factors with first-time offender. Is this a seasonal, reoccurring issue around the same time of year? So April to April or December to December? Or is it 12 months out of the year every year? Has it been going on for 1 month, 1 year, or 5 years? Or is this the first-time offense? Once again, all of those answers vary treatments and prognosis and realistic expectations. So we'll do the best we can. But a lot of them this year will have a seasonality where underlying allergies, which would be the itching and scratching part, and then predisposes to a lot of secondary ear infections. A couple different ways to treat it. Every veterinarian is different. Just go with that. But some patients do just flat out get older, just like people as they get older. They lose their eyesight, they lose their hearing, so on and so forth. Then there's other disease processes with memories, like Alzheimer's, Parkinson's, so on and so forth. Once again, you get the example with, yes, things progress with age, time. Can they happen in any age? Sure. Just depends what we're talking about. But there are hearing tests that are out there. Very few veterinarians have them because there's just not that common to check and test. Generally, most will just do the simple test, clap, calling. Owners will come in with the history and then we'll look into it. But just like in school, when you're getting tested with the beeps, you can do that, but you would just have to call around to some of your different veterinarians and clarify and see if they have it, and then kind of go get a diagnostic test done and confirm it and go from there. A lot of times we will see chronic inflammation and irritation change ear canals, and that can indirectly affect the hearing a little bit. There's ruptured eardrums, and if you get things behind that, that can affect it. A lot of those will resolve with time. There's cancers that get back there. There's infections. Some of those things depends on how far are you willing to go as an owner. Some routes are basically scoping the ear. There's a special word for it. I don't remember what the equipment's called, but basically, can you scope the ear, do a deep ear cleaning, and they can look at the ear, the tympanic. They can look at the eardrum with a video, basically, and look for perforations or this or that, and then sometimes go beyond. CT scans are another way where you can look for tympanic bulla infections or deep ear or middle ear infections. But it just depends how far you're willing to go. Some breeds are more predisposed, and there's actually specialized surgeries that we go in on. Some of those are Cocker Spaniels, but a lot of breeds can get them. So some of it just depends how far you really want to go. Realistically, a lot of them will improve with time, especially if you just had an ear infection. But give it a month or two. If you still haven't seen any improvement or it's getting worse, there's the hearing test, or you kind of might need to do more advanced imaging. And like I said, look for a CT or something like that and go from there. If you're in an area where you have specialists, that's a great option. Here in El Paso, we have a couple, but don't have a dermatologist one or internal medicine. So we get to dabble in a lot of those things. And yeah, so hopefully that helped a little bit, guys, and see if it's a seasonal issue or a year-round issue, and then just take it one step at a time and go from there. Thanks again.